In this video, we will show the difference between traditional and motivational interviewing.
All right, and your hygienist will be with you shortly, okay?
Thank you.
You're welcome.
Hi, Brandy. I'm Victoria. I'm your hygienist for today. So I was going over your health history, and it says that your chief dental complaint is whitening. You want whiter teeth?
Oh yeah, I just want all this white.
Okay.
Yeah.
I really think that your main concern should probably be hygiene, the basics, okay? Yeah. So here's what I need you to do. I need you to brush, okay? I need you to actually care about, getting your teeth clean. That's the first thing, okay? And then floss. You need to floss, okay? Because you're concerned about whitening, not really sure why when you have all this other stuff going on, okay? Do you have any questions? Okay, moving on. Alrighty. Now tell me about your schedule. Do you, why don't you brush? What is it? What's the reason? Why don't you
I mean, I have a kid, I have school, I ain't got time for all that.
Okay, so your teeth are just gonna fall out. That's what's gonna happen. You don't want your teeth
I mean...
No, okay, so let me tell you what actually is gonna happen. Okay, in order for you to get the white teeth, like I said, you need to brush and floss. That's the bottom line. No excuses.
Done?
No, we're not. I'm not done, actually. No excuses. You're going to be a bad example to your kid, okay? So I'm going to get some stuff. I'm going to show you what to do, and when you come back, I expect improvement, okay? Okay, thank you.
Hi, Victoria.
Hi, Ms. Cruz. Do you have a second?
Yes.
Okay, I have an issue.
Okay.
I just had a patient who clearly did not care about her mouth. Her teeth were gross, and I just don't know what to say to get through to her. Her attitude is very poor about it, and I don't know what to do.
All right, so do you remember us going over motivational interviewing last semester?
I do.
Okay, so remember that this is a partnership, so you want to work together with the patient to find out what motivates them, what their goals are, okay?
Okay.
And then resist writing, because you're not always right about everything, and that will turn off the patient, and they won't want to come back and see you.
Okay.
Always understand and make sure you're listening to them. Okay. Ask open-ended questions to get them talking, because you don't want them to say yes or no. Okay. And always remember, before you start giving advice, ask permission first.
Okay.
Make sure they're wanting that advice. And then see what prior knowledge they have. Have them demonstrate how they brush their teeth or how they floss, okay? Find out what they already know.
Okay.
Okay?
Okay.
So if you need any help, just come find me, okay? I'm always here.
Okay. Thank you.
You're welcome.
We'll see. Hi, Brandy. I'm Victoria. I saw you 6 months ago. So, last time I don't think that I really got a chance to understand you. I understand, though, that your goal is whiter teeth, right?
Yes.
Okay, so if it's okay with you, I'd like to go over how we can achieve your goal. Is that okay?
Yeah.
Okay, good. Alrighty, so I understand that you have a kid, right?
Oh yes.
I do too. So I completely understand how busy you are. So tell me a little bit about your schedule. How's your morning? How's your evening?
Oh, we wake up, we're out the door, and then at night time, you read the story, and then you go to bed.
Did you say you had time to brush your teeth in the morning and in the evening, or just probably once a day is more feasible for you right now?
Probably just at night, maybe.
Okay, and that's actually when we would recommend. If you had to brush once a day, probably at night. So, I want you to actually show me how you brush already, okay? I want to see what you know already. So here's a mirror, and here's a toothbrush, and go ahead and show me how you brush. Okay, alrighty, so there's a start. Okay, so one thing I want you to do is make sure that you're aiming those bristles towards your gum line, okay? So I'm going to get some gloves and kind of show you. Alright, so just kind of like that, okay? And back and forth motion, just making sure that you're really cleaning that gum line, okay?
Okay.
Go ahead and show me. Much better. Try to get a little bit more towards the gum line. Good job.
Okay.
And now, go ahead and show me how you floss. Okay. Okay.
Like that.
Okay, so first of all, you want to make sure that your floss is long enough. We say about 18 inches. And you want to take it and wrap it around your hands like that.
Okay.
Good job. Okay, so you want to make sure that you're kind of achieving a C-shaped motion around your teeth. So I'm going to go ahead and hold this up, and you can just kind of look at yourself. Get it in between the teeth. We're going to do one surface at a time. Okay. Okay. Perfect. Good job. Alrighty, Brandy, just to summarize what we talked about earlier, how we can achieve your goal of whiter teeth. You're going to brush at night because that's what works best for your schedule right now, right?
Yes.
Okay, so I'm going to go ahead and give you some whitening toothpaste, okay? And also I'm going to give you some floss, baby steps, okay? Try to use this a few times a week. Eventually we'll work up to flossing daily and brushing twice a day, okay?
Okay, sounds good.
Alright, so there you go. So does your treatment plan work for you?
It does. Thank you.
You demonstrated really well today, and I think together we can definitely achieve your goal of whiter teeth, okay?
Okay, thank
Alright,
you.
you're welcome.
And this semester.
It's okay. It's okay.
Someone calling?
Should we hang up on them?
No.